With PHIG, of course, we were able to get funding in order to fund the interns that we have had at the Minneapolis Health Department. We've been able to host interns and be able to expose them to public health as well as to learn about public health and giving them community engaged experience serving the residents of Minneapolis through their work at the Minneapolis Health Department. So after COVID, a lot of people have been leaving the health department, and that's not just in Minneapolis, that's in general across the country. A lot of people have been leaving the public health workforce, bringing in youth and young adults, and more people into public health in general is incredibly important due to current circumstances, as well as being able to reflect a growing generation of new youth and young adults. We've gathered a lot of data through focus groups, surveys from the beginning and end of the internship that have been able to reflect that a lot of our interns that we have had through these 3 cohorts have learned a lot more about public health than they had known previously to being a part of the internship, as well as being more interested in actually pursuing a career in public health prior to the beginning of the internship. Because a lot of the people that we bring in are not already in public health. We've had an intern who, for example, was pursuing college for business and finance, so we also want to make sure we're bringing in people that are interested in public health and giving them that opportunity to work in public health, even if they don't have that specific experience but are interested in that career change. This internship program has been able to give a lot of people who aren't necessarily considered supervisors the ability to have experience supervising some of the interns that we have had, as well as for supervisors as well, giving them more experience with being able to host interns that are high school age as well as college and graduate student age. So giving them experience working with students, teaching them about public health, as well as in general giving them the experience of what it means to manage youth and young adults within a public health workforce. There have been a lot of supervisors that have been talking about saying that they don't have the capacity to take these programs, that they would love to have an intern, but that they didn't necessarily within their division or unit have the funding to be able to fund having an intern. So with the Public Health Pathways Internship program, through the funding that we get through PHIG, we're able to give supervisors an opportunity to complete those programs that are community facing. Representation is incredibly important, especially in public health, because people want to see that representation and want to see people that look like them. When we're bringing in people of different backgrounds, ages, that have different experiences, they're able to see people that look like them and realize, oh, I can work here too. So that representation is very important for bringing people in the public health workforce so they don't have that feeling they don't belong because they might not see people that look like them, have those same experiences, etc. So bringing in that representation in itself is able to bring in more people and create a more welcoming workforce for everyone in public health.